Normal growth, phases of growth: prenatal period, perinatal period, postnatal period, then preschool child, school age, adolescence. Prenatal period, time period. Zygote, fertilized ovum, less than 2 weeks. Embryo is 3 to 8 weeks, up till 2 months. Fetus is more than 9 weeks. So after 2 months in the womb, it is called a fetus. Perinatal period, 22 weeks up to 7 days after birth. So 22 weeks of gestation and 7 days after birth is your perinatal period. Postnatal growth: newborn, infancy, and toddler. Newborn, first 4 weeks. 0 to 7 days is early, 7 to 28 days is late. Early newborn is your 0 to 7 days, and late newborn is your 7 to 28 days. Also, the first 7 days are also perinatal period. Infancy is up to 1 year. 1 year infant, remember. Toddler is 3 year toddler. Preschool is till 6 years. In 6 years they'll start their school, 6 to 12 years. And then adolescence is 10 to 19 years. Early adolescence 10 to 13, mid 14 to 16, and late is 17 to 19. Pubertal changes: females onset is 8 to 13 years, while it's later in males, 9 to 14 years. Sequence: thelarchy, development of breast; pubarchy, growth spurt, increase height, and then menarche. In males, increased size of testes associated with assessed with Prader's orchidometer; increased size of penis; pubarchy, voice changes, pubic hair appearance; spermarchy, growth spurt, axillary and facial hair. Prader's orchidometer contains beads that corresponds to the size of testes. Tanner's sexual maturity rating, SMR. It is used to assess puberty. It is based on external appearance. So for females, here are the different stages: breast changes, prepubertal, no changes; appearance of breast buds, generalized swelling of breast; form secondary mound, separate projection of nipple and areola; adult-like appearance, flattening of areola and nipple prominence; pubic hair changes, prepubertal, then sparse and straight pubic hair; pubic hair is curly, dense pubic hair; adult-like appearance, hair extends to medial side of the thigh. Males, Tennis SMR for males, penis size 3 is less than 4 ml. The stages are 1, 2, 3, 4, and 5. 5 is adult-like appearance, where it is more than 20 ml. Progression: increase in size and volume of testicles and penis. Darkening of scrotal skin is seen in stage 3 of Tanner's SMR. And the stage 1 is less than 4 ml. Pubic hair changes are same in male and female. Laws of growth: cephalocaudal, head to toe; growth of head in utero; then growth of lower limbs and lower body after birth. Limbs: distal growth, then proximal growth. Fingers will grow first and then the arms. Different tissues grow at different rate. Brain tissue, 90% of growth is completed in the first 2 years. Gonadal growth is increased around puberty, and it produces sex steroids. Lymphoid growths like tonsils, lymph nodes, it becomes palpable. Rapid during 4 to 8 years of age. Skeletal growth, steady process until puberty. Growth spurt at puberty, post puberty. Completion, maturation, fusion of epiphysis. 18 years in females, 20 to 22 years in males, generally taller. Males are generally taller. So fusion of epiphysis is occurring around 18 years in female, but 20 to 22 years in males. Anthropometry methods to assess growth. Weight. Average birth weight of India is 2.8 to 3 kg. Less than 2.5 kg is low birth weight. Normal weight loss after birth. Due to extracellular fluid loss, 10% of body weight is lost in the first week after birth. With respect to weight, it doubles at 5 to 6 months, triples at 1 year, and quadruples at 2 years. Time after birth up to days, weight gain and loss decrease by 10%. By 10 days, by 14 days in preterm, they will regain their birth weight. 10% decrease and then again regain. Up to 3 months of age, they can gain up to 40 gram per day. Up to 1 year, 400 gram per month. Then up to 7 year, up to 2 kgs per year. And after 7 year, 3 kgs per year. Length and height. Length is up to 2 years old, measured while supine with infantometer. Height more than 2 years old, measured while standing with stadiometer. Equipment: stadiometer, movable headboard, height board, fixed baseboard. Infantometer, 1 person at foot end, 1 person at head end. Move quickly and surely to measure length accurately before the baby becomes agitated. Pattern of increase in height. Birth 50 centimeter, then plus 25. 1 year you'll have 75 centimeters, then 2 years you'll have 87.5 centimeters, and then puberty growth spurt, females 16 to 28 centimeter, males 20 to 30 centimeters. By 4 years you will have them at 100 centimeters. Arm span in uncooperative children, distance between middle fingers of outstretched arm. Birth height is more than arm span by 2.5 centimeters. At 11 years of age, height equals to arm span. So by 11 years, your height is equals to arm span. More than 11 years, height is less than arm span by 1 to 2 centimeter. Circumference is a reflection of brain growth. Patterns in head circumference. Birth, it is 34 centimeter, 3 months 40 centimeter, 6 months 43 centimeter, 12 months 46 centimeter, 2 years 48 centimeters, 12 year 56 centimeters, minimal increase. If per month 3 centimeter increase in head circumference, macrocephaly. If per month only 0.5 centimeter increase, then microcephaly. Chest circumference measured at fourth intercostal space, roughly at the level of nipples in children. Head circumference versus chest circumference. At birth, head circumference is more than chest circumference by 3 centimeters. By year, head circumference equals to chest circumference. By 1 year, chest circumference is more than head circumference. Mid-arm circumference measured in age groups of 1 to 5 years depends on muscle mass and fat, indicator of nutritional status, measured at community level. So you have your Shakir's tape here, yellow zone is 11.5 to 12.5, that is malnutrition. Less than that is red, severe malnutrition. And more than that is green, normal nutrition. So it is measured at midpoint, acromion process and oligoclonal process, mid-arm circumference, skin fold thickness, Harpendon's caliper, sides, biceps, subscapular triceps, assessment of subcutaneous fat, nutritional status. Normal skin fold thickness should be more than 10 mm. Severe malnutrition is when it is less than 6 mm. Growth monitoring. Monitored by plotting on growth curves. Types: WHO charts for less than 5 years, Indian Academy of Pediatrics chart 5 to 18 years, and consolidated charts. WHO charts since 2006, internationally used WHO charts. Charts based on multicentric growth reference and multicentric growth reference study with children who had no development anomalies and exclusively breastfed for 6 months, and from developed and underdeveloped countries like India, USA, Oman, Brazil, Ghana, and Norway. Color of WHO charts: blue is for boys, pink is for girls. Variance: percentile frequency distribution of a given value. Standard deviation: deviation from mean value, 50th percentile. Interpretation of growth charts. So here you can see the high and low sides. Stature: stunting, short stature, less than third percentile or -2 st on the chart. Severe stunting, less than -3 st. Undernutrition, weight for height. Wasting, less than third percentile, severe wasting, less than -3 st. Status: weight for age. Underweight, less than third percentile, severely underweight, less than -3 st. Status: weight for height. Overweight, +2 to +3 st. Obesity, +3 st. More than +3 st. So you can easily remember this. It is similar. Less than third percentile or -2 st, and it is severe when it is more than -3 st. But for obesity, it is weight for height, and there you have +2 to 3 st as overweight, and obesity is when it is more than 3 st. IAP charts. Height for age chart which assess stunting, less than -2 st or less than third percentile. BMI charts, age. So you have your thin, overweight, and obesity zones, percentiles. (23) adult equivalent, 27 adult equivalent. And this is the end, and we'll start with the abnormalities of head size and shape in the next video.